Hello and welcome to the 2020-2021 Med Security Employee Benefits Enrollment Meeting. During the next 10 to 15 minutes or so, we're going to be covering medical, dental, and vision, and all the related benefits that are offered through Med Security. Before we get started, a couple of housekeeping items. Towards the bottom of this page, where my hand is scrolling over right now, you'll see qualified life events. So our policy goes into effect October 1st, and in general, you cannot change your election that you make during open enrollment until we're in open enrollment next year. Now, the exception to that is one of these qualifying life events like marriage, divorce, birth of a baby, things of that nature. So unless one of these things go on in the middle of the year, then what you pick sticks for 1 year. We'll spend most of our time on medical because we are making a change to a new carrier, Humana. ID cards will be sent to your house, but until we get there, we'll process it on our end. I work for a company, my name is Ben, for a company called Catto&Catto. We are insurance nerds and brokers, and we support Melissa and Lindsay and their team to make sure that anything related to insurance is done well. What you'll see here are two options. You have a base option and you have a buy-up option. One is a little less expensive, one is a little more expensive. The less expensive option has higher copays. The more expensive option has lower copays to go to primary care specialist. You'll see the retail clinic copay. You'll also see virtual visit copays as well. Virtual visit is that 24/7, 365 access to a doctor over your phone. The base plan has a $5,000 annual deductible. Now that deductible runs January to December. The buy-up plan has a $1,500 deductible. After you meet your deductible, you're sharing in costs. That's what coinsurance is. You pay 30 cents on the dollar after $5,000 on the base plan. You pay 20 cents on the dollar after the deductible on the buy-up plan. And you keep paying either 30 cents on the dollar or 20 cents on the dollar until you hit your out-of-pocket max on either of these plans, which is $6,500 on the base plan or $5,000 on the buy-up plan. And again, that's an annual number, January to December. Prescriptions are covered via copay. It depends on which tier of coverage that the drug falls on. That will register with the associated copay for that plan. You do have out-of-network benefits on Humana as well. Those are listed in gray, but those numbers are always higher. Humana has a pretty decent network access in all of the markets where Med Security is. And so we don't expect any problems, but it also doesn't mean that every single doctor is in the network. If you're on a medication that Humana says is a mandatory generic, they have a mandatory generic policy. That means if there is a generic equivalent available, Humana is going to require you to go to that generic. Now, if that doesn't work, that's okay. You just need your doctor to write dispense as written on the note so that it will be approved by the plan. Cost per month, please call in to HR to get this, but I do want to go over this piece. If you're enrolling in the base plan option, the good news is it's a lot less expensive than it was last year. Yay! So your pay period cost will vary depending on your income. Your share is 9.78. That follows all the Affordable Care Act guidelines of the cost for the employee-only tier. In 2021, the affordability factor, it goes up and down. So it kind of bounces around every year. So we'll always index it to whatever is compliant for that particular year. So in 2021, it'll go to 9.83%. That'll come out of your paycheck. And then you'll have affordable health care coverage, which is good. But the bottom line is you're not going to pay more than $216.14 per month for employee-only coverage. But again, please call into HR for your specific rate. Couple of rules for the road. Virtual visit is the least expensive. Those are just on a copay. Then go into the doctor's office, a retail health clinic, or sometimes inside of like CVS or Walgreens, or sometimes inside grocery stores. The part that is the most confusing to people is what is an urgent care versus freestanding versus hospital emergency room. A freestanding emergency room is a true emergency room outside of a hospital setting. So it is not attached to the hospital. Some folks think they're walking into urgent care, but they're actually walking in to a freestanding ER, and you go and get a big old bill if you make that mistake. So please know where you go. This is what we referenced earlier. Doctor on Demand is the name of the virtual care 24/7, 365 access to a doctor. We'll let y'all read through that information on these next 2 pages. And then we'll be talking more about this at the appropriate time. Go365 is a wellness app that is embedded within the Humana policy. There are lots of ways to earn points. It's way easier than you may think. Honestly, you just start tracking your steps and you'll start to accrue some points. So for the purpose of today, we're not going to go through this, but I would say download the Go365 app, and then we'll be giving y'all some more information from our office through Med Security to be able to hop into the program. I actually have Humana as my insurance carrier. I'm on Go365 as well, and so if I ever walk around without my Fitbit attached to my watch, I kind of think that I'm getting cheated out of steps. So I like to get as many steps as I can, and that does 2 things. Steps can be for education, fitness, prevention, or healthy living. They all have different points associated with them. And it can actually reduce your insurance rates, which is cool, but it can also get you gift cards to like Amazon or Best Buy or places like that. So we have a large amount of clientele with Humana, and a lot really like this Go365 program. So we'll talk about that more in the future. Let's talk about your teeth and your eyes, and then we'll be done. We changed from Dental Select last year to Humana. The policy is about the exact same. Basically what it does is you get $1,000. I'm highlighting it right here, $1,000 per mouth. So if you have 3 kids and 1 spouse, it's 1,000, as you go throughout the year. So you go in and you get your 2, check that out, not even 2 teeth cleanings, 3 teeth cleanings, which is pretty cool. Per year, that's $0. And then if you have treatments, like if it's a basic service, for example, like a cavity, and let's say the cavity was $200, then you've got a $200 cost minus your $50 deductible equals $150. You're paying 20% of that $150, or $30. The insurance company is paying 80% of that $150. Or $120, and that $120 posts against this $1,000 annual max. That's how that works. Costs are right there at the bottom. And then we've got vision. We switched to Humana for vision as well. The network is called the iMed Insight Network. You'll pay $10 to go in and get an exam, and then you'll have some allowances. You'll either get $130 for cool guy or cool girl frames, or contact lenses. What this once every means is you can't get both glasses and contacts at the exact same time. And so just be aware that you can get either or at the same time. If you need both at the same time, honestly, a lot of the online retailers like Zenni Optical or Warby Parker have some pretty darn good deals if you need to get both glasses and contacts at the same time. EAP is a freebie, paid for 100% by Med Security. Free counseling. Who doesn't have a little bit of stress going on with COVID right now? So you can call and get some referral services, or some folks really like some online will prep features that are already included in the EAP. Premium only plan just means that you're not taxed on this income, which is a good thing. Here's some more information about what is included in the EAP that is free to you. Just got to call in to access it. So we'll let y'all look through this at a later time. Here's the number, or humana.com EAP. The rest of this information, great late night reading material, required notices. It might be a little dizzy to run through, but we will end on our contact information and things that you already know in regards to, here's Melissa's address there in San Antonio. some Q&A, enroll, terminate, or make any changes to medical, dental, or vision. We're on a quick turnaround right at this point in time. It does go into effect October 1st. So we'll also send out an enrollment form. There's HR's number, or you can contact Sachi Lucas in our San Antonio office, who will be able to assist with any questions. Y'all have a great day, and thanks for listening.